So we all know that COVID-19 infection continues to pose a serious threat to patients and healthcare workers due to its contagious nature, especially now that Omicron variant is in the horizon. We all know that Omicron cases, for example, in United Kingdom are climbing back to near January pandemic peak levels, while Scotland and England are rising fastest in the recent days. In fact, the UK government is again warning of a big new wave in cases driven by rises in Omicron over the coming weeks, with the first death ever reported from Omicron infection this December 13. What we really don't know is how bad the consequences of Omicron infection will be, but it is certain that they will be worse than they would have been without Omicron. So the latest report confirms that Omicron is actually doubling every 2 to 3 days in the United Kingdom and does have a large growth advantage versus Delta due to its increased transmissibility. So nearby, in recent South Korea data, their daily count of COVID-19 cases has already surpassed 7,000 cases for the first time, with experts attributing the record jump to waning immunity after 2 doses of primary series of vaccines, specifically among older people. Again, infections were rising, particularly in this age group who had suffered a significant drop in vaccine efficacy and of children who have not yet received their first doses. Worst is the fact that there's the rising number of infections due to Omicron variant. Right now, South Korea has reported 90 Omicron variant cases that has been discovered by Saturday, and at 67 of them, more than 70% were of local infections. On the other hand, the Philippines will likely face a serious surge of COVID-19 infection should the Omicron variant enter the country's borders. Remember, it's now December, and we have both Ws and we may have some foreign nationals who are coming over to celebrate Christmas. So should Omicron variant enter the country, then we could probably expect a surge of COVID-19 infections based on the research or production by the independent pandemic monitor Octa Research recently. And true enough, as an update, the Department of Health, the University of the Philippines, Philippine Genome Center reported that 2 imported cases of Omicron variant of concern were detected from the 48 samples sequence as of December 14, 2021. These 2 Omicron variant cases are coming from incoming travelers and currently isolated in a facility managed by the Bureau of Quarantine. So we have to remember that the vaccine efficacy will always take a big hit when Omicron variant infection comes into the country, and that one really needs the booster dose to protect against Omicron infection. Meaning, even if you have been vaccinated and we left ourselves off guard without a mask because we're celebrating Christmas with members of the family or friends in an enclosed space, then COVID transmission can still occur and the vaccinated people can still get the breakthrough infection. So for those who are awaiting the booster doses, who have not yet received their booster doses, or those you feel you've been exposed and may have had infection, if the mouth and nose of these patients with infection are irrigated with antimicrobial solutions, maybe the transmission can be minimized or prevented, and at the same time, infection controlled on site. So for today's video, we're going to discuss what are some of the data that will help protect us against COVID-19 infection, specifically with regard to the use of antimicrobial mouthwash and nasal spray. Let's watch this. I am really sure that you may have used one yourself, or you have heard about mouthwash and nasal spray as a way to prevent you from possibly getting COVID 19 infection. One such mouthwash and nasal spray that have been very commonly used and spread in the social media that we can easily get over the counter is the povidone iodine mouthwash and nasal spray. So far in 2021, published papers on mouthwash and nasal spray, however, from different parts of the world have started to be analyzed, and preliminary data have shown important benefits to these regimens, although not conclusive. And therefore, you see in social media some of your friends who are advocating the use of mouthwash and nasal spray as healthcare workers, as patients, anytime they go out to socialize. We know that povidone iodine is one commonly used antiseptic with decades of clinical use. Its safety profile has been well established, and in fact, if you look at allergy to this substance, they are also extremely rare. In fact, its administration is simple, cheap, and rapid, and that it is readily available in the pharmacies either as a gargle or as a nasal spray. In fact, sensitization cases have been shown to be extremely rare. Now, the exact duration of the virucidal activity of povidone iodine once applied to the mucosa is unknown, but it is thought to be as long as 3 hours. At present, there is considerable evidence of benefit on the use of povidone iodine antiseptic for the maintenance of oral health, prevention, and treatment of any oropharyngeal infections. But again, this is not yet recommended to be used alone, but rather as an adjunct to the currently recommended safety protocols, including the fact that it is now recommended for immediate and United Kingdom wide use for this mouthwash and nasal spray in healthcare workers and their patients, as described, to minimize the risk of spread of COVID 19. One other study that really Ned mentioned and showed promise about mouthwash and nasal spray was the one from Singapore. It's about the throat spray that found to reduce the risk of COVID 19 infection. This is actually a local study of around 3,000 healthy young migrant workers who were quarantined in a dormitory in May last year, done by a team of clinician scientists from the National University Health System of Singapore. The study clearly showed that those taking povidone iodine throat spray 3 times a day reduced the likelihood of getting infected with SARS-CoV-2, the virus that causes COVID-19, by as much as 20%. The researchers then concluded that the use of povidone iodine throat spray, which are easily available and have known to have safety profiles, can therefore represent a viable preventive strategy for individuals living in close and high exposure areas, especially in areas and countries where COVID 19 vaccination is still in the process of achieving herd immunity. But one very important comprehensive review on nasal spray and mouthwash that included povidone iodine, which is for me very practical in terms of its approach and recommendation, because not only it included povidone iodine but also other substances that some patients use, like chlorhexidine, hydrogen peroxide, and carrageenan, which are widely used worldwide, was recently published late 2020 in Future Microbiology. In this review paper, there were a lot of selected published papers that were included and analyzed. The study in general concluded that these substances are actually deemed safe to use, but cautioned that while nasal sprays and gargles cannot replace the use of traditional personal protective equipment like gowns, masks, and protective eyewear, the use of nasal and oral antisepsis has the potential to be useful for combating SARS-CoV-2, and that clinical trials continue to be underway will be the best mechanism to determine the true benefit of these compounds and the role in mitigating disease progression and transmission of coronavirus infection. The review also provided us with an executive summary of their findings outside of what we usually use. First, that povidone iodine like betadine, ethanol and essential oils like listerine, and a combination of xylitol and carrageenan, which are purified from red marine algae, was shown to reduce viral load of SARS-CoV-2. That chlorhexidine, a widely used oral rinse, does not act quickly in reducing viral load in 30 seconds as povidone iodine substance, but it helps because it binds to cell proteins, extending protection. But one substance that we don't recommend at the present time, and the study does not recommend, is hydrogen peroxide. Hypertonic saline was also not very effective, but it halted replication of the virus by increasing hypochlorous acid inside the cell. So, in conclusion, COVID 19 spreads from person to person primarily through droplets that are produced when an infected person coughs, sneezes, or talks, thereby administering antimicrobial mouthwash to rinse the mouth and nasal spray sprayed into the nose to people who may harbor the COVID 19 virus might help them fight the infection and prevent them from infecting the healthcare workers or their siblings or other friends. These antimicrobial mouthwashes and nasal sprays are liquids that work as added layer of protection by killing and stopping the growth of microorganisms such as viruses or bacteria. It is, however, possible that using mouthwash or nasal spray could cause a variety of unusual, unwanted adverse events, including irritation, allergic reactions, or loss of smell. It may also remove microorganisms from the mouth or nose that are useful for protecting the body against other infection. But as with other any medical treatment, antimicrobial mouthwash and nasal spray have the potential risk as well as benefits, and therefore it is best that before you use it, the best discuss it with your doctor. But again, before I end, the use of this mouthwash and nasal spray should be done with caution and should only be used as an added layer, if you have to do it, added layer of protection aside from your vaccination, face mask, and social distancing. I hope this helps clarify the issues on antiseptic mouthwash and nasal spray. Again, this is Dr. Jerry Tan. See you again soon.